show starts in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go. Bass in your face. Bass in your face.
Good evening, everybody. Welcome to another episode of Uncommon Sense with Jose Negron. Now, for the benefit of those of you who are not familiar with the channel or are watching this channel for the first time, the reason why it is called Uncommon Sense, because here on this platform, we discuss everyday issues where we try to find logical solutions, but not everyone uses logic. So for that reason, it is called Uncommon Sense. I also have a much smaller YouTube channel called Latina Diaspora, where I discuss issues pertaining to Latinos residing in the United States. Um, the, the link to that channel is in the description. I want to let everybody know that I'm currently live on YouTube, Facebook, and Instagram. And also the subscriber mode has been enabled, meaning if you're not a subscriber and if you wish to enter a comment in the chat, you will need to subscribe to the channel. As always, I want to give a huge shout out to all those who have already subscribed to the channel. Whether you've been a supporter from the very beginning or just recently joined as late as today, I really appreciate your love and continued support. I also want to give a huge shout out to all those who follow me on social media. And I also want to give a huge shout out to all those who allow me to enter into your devices and those who watch from the clouds, even the haters. So what I'm going to ask you to do, if you have not done so already, I'm going to ask you to please subscribe, like, and set the bell notification to all. So therefore, whenever I do produce content, you will have the opportunity to catch it live or catch it on playback. Now, tonight's topic is going to be on depression. Now, in all fairness, I have discussed this before. Okay. Now, the reason why I'm speaking about it again, because it is an issue where many people, has dealt with it or are dealing with it. So, I will be describing what it is and what some of the symptoms and what can we do to deal with this situation. One thing we need to bear in mind is that anyone can be in a state of depression through many circumstances. But before we get into the main topic, we're going to have another episode of In My Words. So first of all, I want to start out that last night my friend AMR had a live stream regarding MLS, which is I think is multi light skin or multi-generational light skinned people. I'm not too sure. It was good to see him do some live content. Now he's been very busy, okay, with his life because some of us do actually have a life outside of YouTube, and of course, it was a pleasure to share some facts about interesting information, and I would say if you have not done so, show some love and check out his content, subscribe. Okay, he is a young YouTube creator. I believe he is a millennial. Okay. But he's an example of a content creator who does create, produce positive quality content. So it's good to see him live. Okay, hopefully, you'll be able to create some more content depending how his schedule is. Now, one person that's been kind of MIA for a while as far as content, um, Dreadlock Diaries, and she also have another YouTube channel called NY Grapevine. I think that she might have done a short here or there, but we haven't seen too much content from her. Okay, I imagine she's been very busy. Okay, with her life and things of that nature, or maybe she just decided to take a YouTube sabbatical. Okay, which at times it could be necessary. Okay, particularly if if you're busy with the daily cares and concerns of your life, and also sometimes you just need a break so we can refresh and come up with some new creative ideas. Of course, I want to say Happy President's Day. Okay, today we remember all the men who served as presidents. One thing we have to bear in mind is that not all the men who occupied the White House were men of high moral character. Okay, we do have some men who made some highly controversial decisions. Okay, um, regarding some of the policies that has to do with some of the in so-called indigenous people, and also the fact that during our history, there's been treaties that we made which we not always kept. Okay, I know that this is not considered a popular topic, but I think we need to be realistic. Okay, and we need to give an accurate and truthful portrayal of our history. While this country has done a great many things, the country's also done some controversial things. Okay. And of course, we are in the middle of Black History Month, where we acknowledge all the achievements that the African American community has achieved, which are many. And considering the fact that no other community has undergone such adversity as the African American community, uh, first of all, being forced against their will to leave their native lands and to come here to the United States as slaves, being deprived of their identity, history, culture, and forced to adapt to culture here in the United States. And then after that, with the ending of Reconstruction, the fact where they were forced to live under segregation and things of that nature, and then the struggle to obtain uh, civil rights and equal rights. Okay, and that struggle still continues today. Okay, and I'm not referring to the current administration. I'm just referring in history in general. Uh, no other community has overcome as much as the African American community has overcome. Um, I would say the only one that's comparable is the indigenous people here in the United States. Uh, let's see what else. I'm still thinking of a topic for my other channel, which is Latina Diaspora. Um, I'm most likely going to do a stream on Saturday. Um, when probably in the afternoon. So we shall wait and see. And of course, one thing we do have to bear in mind that it is time consuming to create content. Okay. First of all, you have to think about a topic that you want to talk about. Then you have to then you have to prepare your research and prepare your facts, and then actually create the string. So there are people who like to think that all you do is just open up StreamYard and you start to talk. I mean, no, you actually have to prepare properly if you want to do a quality stream. Okay. Now there are those who can, they can do in a wing and a prayer, and and don't need much preparation. But I prefer to devote time to prepare to make sure that I'm speaking facts and not just opinions. Okay. Particularly when it comes to this topic. Now, um, I will allow anyone who is interested to share the string on their platforms. I just ask that please do not use this content to attack other people. Okay. Particularly when it comes to this topic, when it comes to depression. Okay. And unfortunately, there's still a great many taboos about it. Well, in any case, with that being said, we're going to get into the main topic. Now, I do want to state for the record that the link to join the panel has been pinned. Should anyone at any point wishes to hit the link and join the panel, they can do so. I must continue to state that seen you before. If I never heard from you before, I will insist that you come up in the backstage to make sure that no one flashes anything inappropriate, which will cause the people of YouTube to take down their stream. Now, some of you might be getting sick and tired of the same declaration. It's necessary, okay? Because unfortunately, you have certain individuals that will try to disrupt things and try to create chaos. And one way is to actually, troll the channel and then show inappropriate images. Okay. Now I have been fortunate because no one has tried, but then again, I don't believe in leaving things to chance, and I have to do what I can to maintain some semblance of order here on this channel. So in any case, I know that other YouTube creators are live as we speak. So I have a feeling we're not going to get too many people hopping on live. Most likely people are going to catch this on the playback, which is understandable. I mean, that's the reality here in these YouTube streets, is that you have many times you have more than one content creator that will be live at the same time that you are. Now, when it comes to depression, many people fall in state of depression for many reasons. But before we do that, let me just see if I can share my screen. Okay. Now, actually, the image I'm going to look is from the American Psychiatric Association. And as you can see, what is depression? And one thing that's very important here on this platform, when I discuss a topic, uh, I believe in giving clear definitions. I don't believe in just talking just for the sake of talking. Unfortunately, we have a situation where people use terminology uh, and they speak out of context. So let's first of all let's take a look at the definition. Depression is a common and serious mental disorder that negatively affects how you feel, think, act, and perceive the world. Now, nearly 29% have been diagnosed with depression at some point in their lives, and about 18% are currently experiencing depression, according to a 2023 national survey. Women are more likely than men, and younger adults are more likely than older adults to experience depression. While depression can occur at any time and at any age, on average, it can first appear during the late teens and mid 20s. And these are the symptoms. Okay. Now, you're going to see, now, as you can see on your right, is the telephone number for the, I'm going to say it because it's a description, the Suicide and Crisis Lifeline. Okay. And it's a call free number. It's 988. You can call or text to speak with someone, or you can chat online. So here are the symptoms regarding those who are in a state of depression: feeling sad, irritable, empty, and or hopeless; losing interest or pleasure in activities you once enjoyed; a significant change in appetite, eating much less or much more than usual; and or weight loss or gain unrelated to dieting; sleeping too little or too much; decreased energy or increased tiredness or fatigue; increase in purposeless physical activity, inability to sit still, pacing, hand wringing, or slow movements or speech that are severe enough to be observable by others; feeling worthless or excessively guilty; difficulty in thinking, concentrating, forgetfulness, and or difficult in making minded decisions; thoughts of death; self-deletion, adulation, or self-deletion attempts. Now, let me just make this clarification. Now, when it comes to that, I'm going to use the term self-deletion, okay? And there's a reason why, because there's certain terminology that you have to be careful, okay? So when it comes to the terms like suicide, I'm going to be using self-deletion. It is normal to experience moments of sadness or feeling down in the dumps or in the blues as part of human experience. However, a diagnosis of depression requires the above symptoms to occur most of the day, nearly every day, for more than 2 weeks, along with a clear change of day-to-day function, whether it be in work, school performance, personal relationships, and hobbies. It is, however, treatable. Now, there are certain risk factors for depression. Depression can affect anyone, even those who seemingly have it all. Several factors can play a role in depression. Several factors. Okay. Biochemical. Differences in certain chemical in the brain, such as the neurotransmitters serotonin, dopamine, and norepinephrine may contribute to symptoms of depression. Genetic depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime in their life. Personality. People with low self-esteem are easily overwhelmed by stress or are generally pessimistic, may be more likely to experience depression. Environment. Continuous exposure to violence, neglect, abuse, or poverty can also pose risk for developing depression. Now, it can be treated through several means. Depression is among the most treatable of all mental disorders. Between 70 and 90% of the people with depression eventually respond well to treatment. To diagnose depression, a healthcare professional will conduct a thorough diagnostic evaluation that will include a comprehensive interview to discuss your symptoms in addition to your personal, medical, and family histories. Moreover, a physical examination should be performed to screen for underlying medical conditions that may mimic depression, such as hormonal imbalances, vitamin deficiencies, neurological problems, and drug or alcohol use. Laboratory and imaging tests may also be included in the evaluation as part of the medical screening. The evaluating medical professional will take all these factors into account as they form a diagnosis and recommend an individual treatment plan. Excuse me. Medication. Brain chemistry may contribute to the individual's depression and may factor into treatment. For this reason, antidepressants may be recommended. These medications are not sedated, uppers, or tranquilizing. They are not addictive. Antidepressants may produce some improvement within the first week or two of use, yet full benefits may not be seen for 2 to 3 months. If a person feels little or no improvement after several weeks, the psychiatrist, healthcare professional may recommend adjusting the dose, adding a new medication, or switching to an alternative antidepressant. In some situations, other classes of psychiatric medication, such as mood stabilizers, may be helpful. It is important to let your healthcare professional know if you have concerns about your medication or experience any side effects of the medication. Psychiatrists usually recommend that patients continue to take their medication for 6 months or more after the depression symptoms have improved. For certain people at risk, for example, those who have experienced multiple episodes of depression in the past, or those who have a strong family history of depression, long-term maintenance treatment may be suggested to decrease the risk of future episodes. Another option is psychotherapy. Or talk therapy is often recommended. Cognitive behavioral therapy, CBT, is one of the most common forms of psychotherapy, has been found to be effective in treating depression. CBT focuses on recognizing and correcting unhealthy thinking patterns with the goal of changing thoughts and behavior to respond to challenges in a more positive manner. It may be used alone or in combination with antidepressant medication. Psychotherapy may involve one or more people. For example, family or couple therapies can help address issues within these close relationships. Group therapy brings together in a therapeutic environment a cohort of people who are similarly experiencing depression, providing an opportunity for mutual learning and support. Depending on the severity of the depression, treatment with psychotherapy can last a few weeks or longer. Significant improvements can be made in 10 to 15 sessions. electroconvulsive therapy, or ECT. ECT is the medical treatment that generally reserved for those with severe depressive episodes who have not responded to treatments. ECT has been used since the 1940s, and many years of research have led to major improvements and the recognition of the effectiveness as a mainstream rather than a last resort treatment. ECT is a procedure performed under anesthesia during which the brain is stimulated electronically to induce a brief seizure. A patient usually receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. It is usually managed by a team of trained medical professionals, including a psychiatrist, an anesthesiologist, and a nurse or a physician assistant. Self-help and coping. Now let me just check and see. Is okay. I wanted to see if they might have been in the backstage, so I'm going to continue. There are a number of things people can do to reduce the symptoms of depression. For example, many regular exercises help create a positive feeling and improve mood. Getting enough quality sleep on a regular basis, eating a healthy diet, and avoid alcohol as a person can also reduce the symptoms of depression. Depression is a real illness and help is available. With proper diagnosis and treatment, the vast majority of the people with depression will overcome it. If you experience the symptoms of depression, the first step is to see a family physician or psychiatrist. Talk about your concern and request a thorough evaluation. Now, these are related conditions. I'm not going to go into detail, but these are. Now, one thing that's important. There's a difference between depression or sadness or grief, bereavement. The death of a loved one, the loss of a job, or ending a relationship are difficult experiences for a person to endure. It is normal for feelings of sadness or grief to develop to respond to such a situation. Those experiencing loss might even describe themselves as being depressed. But here's an important fact. But being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from the usual activities. They also have different and important ways. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased. A major depression, mood, and or interest, pleasure are decreased for most up to weeks. In grief, self-esteem is usually maintained. In major depression, feeling of worthlessness and self-loathing are continued. In grief, thoughts of death may surface when thinking about or fantasizing about joining the deceased loved one. In major depression, thoughts are focused on ending one's life due to feeling worthlessness or undeserving of living, being unable to cope with the pain of depression. Grief and depression can coexist. When grief and depression coexist, the grief is more severe and lasts longer than grief without depression. Distinguishing between grief and depression is important, and it can assist people getting the help, support, and treatment that they need. And these are some other resources that now I'm gonna park it here. Good evening, Irby. Thank you very much for stopping by. Tonight's topic has to do with depression. So what I just did, I just gave a clear definition. What is depression and what are the symptoms? Because here on this platform, um, what I do is when I discuss something or share information, it's very important to give clear definitions on what they are. Unfortunately, we're living a day where people will talk about things, but yet they do not know the true sense or the true meaning behind what they're talking about. So it was very important uh, for me to give a definition of what is depression. Okay. Now, one thing we have to bear in mind, um, it's not easy for people to admit that they are in a state of depression, particularly if you are a male. Okay, because in this society, men are taught not to be vulnerable. Men are taught to just, you know, just be stoic and not complain and just go with the flow. Okay, and unfortunately, when you have some men who publicly acknowledge that they're depressed or they're going through bouts of depression, they are unfortunately they are often ridiculed. Okay, so what that does, it does not encourage any these people um, to acknowledge that they have a problem and then try to get help. And depression can come, in many areas. I mean, you can experience um, the loss of a loved one through death. You can also experience the loss of a romantic interest. Also, issues with your physical health. Uh, Now, one thing that makes it even more difficult is that feelings of low self-esteem. Okay, and people tend to think that they're not worthy, that they're not loved, and then unfortunately, um, their state of depression can deteriorate, you know, and then to the extent where if left untreated, they can have thoughts of self-deletion. Now, this is something that I have personally experienced. There have been times in my life when I had suffered bouts with depression, uh, usually because of a broken heart. And it took me a great deal of time and effort to heal mentally and emotionally. And yes, there have been times where I thought about self deletion. Okay. I was fortunate that I was able um, to get the help that I needed, okay, in the form of therapy, in the form of seeing a therapist and having um, a support of love. So I was able to deal with that. Um, and of course, we're living in a day where people are not always encouraged to seek therapy, um, particularly when it comes into the Latino community. that could be even worse, particularly if you're talking about um, people of my generation. Um, for those of you who are not familiar, I am what being classified as a baby boomer. I was born in the early 1960s. So, of course, we would not encourage uh, to seek mental health professionals, much less uh, not to acknowledge that we were depressed and things of that nature. Um, because again, men are not supposed to be depressed. Men are not supposed to be down. Men are supposed to be stoic. Men are supposed to be tough. Okay. Well, when you're going through uh, about the depression, um, the last thing you want to hear is like people tell you just snap out of it, or just you know, you know, and ignore what you are feeling, because that's because ignoring it only makes it worse. And of course, the key is to acknowledge that you have a problem, to acknowledge that you are in a state of depression, to acknowledge that you're down, to acknowledge that you need help. Okay. And really, there is no shame to acknowledge that you need therapy. There is no shame that if you need to reach out to a competent mental health professional. Okay. I just want to see. Okay. Oops. Um, you have to excuse me, but every so often, what I would do is I would check and see if anyone that's watching through Instagram, because one thing, unfortunately, I'm not always on top of it. Okay. But what I'm going to do is I'm going to share another article. Just give me a moment. So now I'm going to share my screen. So the next thing I'm going to share is something from the World Health Organization website. Okay. Um, Now, it's been classified as depressive disorder, but it's another term for depression. So now this article was created in March 31st of 2023. So here is some key facts to consider. Depression is a common mental disorder. Globally, an estimated 5% of adults suffer from depression. More women are affected by depression than men. Depression can lead to self-deletion. And there is effective treatment for mild, moderate, and severe depression. Depressive disorder, also known as depression, is a common mental disorder. It involves a depressed mood or loss of pleasure or interest or activities for long periods of time. Depression is different from regular mood changes and feelings about everyday life. It can affect all aspects of life, including relationships with family, friends, and community. It can result or lead to problems at school and at work. Depression can happen to anyone. People who have lived through abuse, severe losses, or other stressful events are more likely to develop depression, where women are more likely to have depression than men. Excuse me. An estimated 3.8% of the population experience depression, including 5% of adults, 4% among men, and 6% among women, and 5.7% of adults older than 60 years old. Approximately 280 million people in the world have depression. Depression is about 50% more common among women than among men. Worldwide, more than 10% of pregnant women and women who have given birth experience depression. More than 700,000 people die due to self-deletion every year. Self-deletion is the fourth leading cause of death in 15 to 29-year-olds. Although there's no effective treatments for mental disorder, more than 75% people in low and middle income countries receive no treatment. Barriers affected to care include lack of investment in mental health care, lack of trained healthcare providers, and social stigma associated with mental disorders. Again, this is a problem in many societies. People are frowned upon if they acknowledge that they have mental health issues and that they need treatment. Now, during a depressive episode, a person may experience a depressive mood, feeling sad, irritable, empty. They may feel a loss of pleasure or interest in activities. A depressive episode is different from regular mood fluctuations. They last more than a day and nearly every day, or at least 2 weeks. And these are the symptoms: poor concentration, feeling of excessive guilt or loss of esteem, hopelessness about the future, thoughts about dying or self-deletion, disrupted sleep, changes in appetite or weight, feelings of feeling very tired or low in energy. Depression can cause difficulty in all aspects of life, including in the community and at home, work, and in school. A depressive episode can be categorized as mild, moderate, or severe depending on the number and the severity of symptoms, as well as the impact on the individual functioning. There are different patterns of depressive episode, including single episode depressive disorder, meaning the person first and only episode; recurrent depressive disorder, meaning the person have a history of at least 2 depressive episodes; and bipolar disorder, meaning the depressive disorder alternate with periods of manic symptoms, which includes euphoria or irritability, increased activity or energy, and other symptoms such as increased tardiness, racing thoughts, increased self-esteem, decreased need for sleep, distractibility, and impulsive reckless behavior. Now, depression results from a complex interaction of social, psychological, and biological factors. People who have gone through adverse life events, unemployment, bereavement, traumatic events are more likely to develop depression. Depression can in turn lead to more stress and dysfunction and worsen the affected person's life situation and the depression itself. Depression is closely related to and affected by physical health. Many of these factors that influence depression, such as physical inability or harmful use of alcohol, are also known risk factors for disease such as cardiovascular disease, cancer, diabetes, and respiratory diseases. In turn, people with these diseases may find themselves experiencing depression due to the difficulty associated with managing their condition. Good evening, April Charles. Thank you very much for stopping by. Okay. So I see that you're taking Zoloft for your bouts of depression. Um, I just want to share with you. I have experienced both with depression. Um, I dealt with it undergoing therapy. So I just want to say that you're not alone. Um, Many people go through uh, bouts of depression. So, and the key is to acknowledge that you have a problem and to get the treatment that you need. Now let me just move this a little bit. Prevention programs have been shown to reduce depression. Effective community approaches to prevent depression include school-based programs to enhance a pattern of positive coping in children and adolescents. Interventions for parents of children with behavioral problems may reduce parental depressive symptoms and improve outcomes for their children. Exercise programs for older persons can also be effective in depression prevention. Now there is, excuse me, treatment. There's effective treatments for depression. They include psychological treatment and medication. Seek care if you have symptoms of depression. Psychological treatment are the first treatments for depression. They can be combined with antidepressant medications in moderate and severe depression. Antidepressant medication may not be needed for mild depression. Psychological treatment can teach new ways of thinking, coping, or relating to others. They may include talk therapy with professional and supervised lay therapists. Talk therapy can happen in person or online. Psychological treatment may be assessed through self-help manuals, website, and apps. Effective psychological treatment for depression includes behavioral activation, cognitive behavioral therapy, interventional therapy, problem-solving therapy. Antidepressant medication may include serotonin inhibitors such as fluoxetine. Healthcare providers should keep in mind the positive adverse effects associated with antidepressant medication, the ability to deliver either intervention in terms of expertise and or treatment availability and individual preferences. Antidepressants should not be used for treating depression in children and are not the first line of treatment in adolescents among those that should be used with actual cause. Now, another thing you can do is called self-care. And what's the thing? Try to keep doing activities you used to enjoy. Try to stay connected with family and friends. Exercise regularly, even if it's just a short walk. Stick to regular eating and sleeping habits as much as possible. Cut down on alcohol and don't use illicit drugs, which can make depression worse. Talk with someone you trust about your feelings. Seek help from a healthcare provider. Now, what I'm going to talk about is extremely important. If you have thoughts of self-deletion, remember you are not alone, and many people have gone through what you're experiencing and found help. Talk with someone you trust about how you feel. Talk to a healthcare worker such as a doctor or counselor. Join a support group. If you think you are in danger or harming yourself, contact any available emergency services or a crisis lifeline. Okay, and we're gonna park it here. So let me just, oops, excuse me. Now, again, anyone can fall into a state of depression, and then, and it's something. It's nothing. It's not something to be ashamed of. Okay. And one thing to bear in mind: when you're able to recognize that you have a problem, you're halfway home. Okay. Because at this point, at least you are aware that you're having a problem. And that make put you in a proper frame of mind to take action. Which among all things, seek um, seek a healthcare provider by all means, whether it be a therapist or a doctor. Okay, and be honest. Be honest. That's very important. Okay. Now, with some people, it could be very difficult to divulge um, certain aspects of their lives and certain symptoms that they are experiencing. However, the key to recovery is to acknowledge, fully state what are the symptoms that you're going through. It's the same thing when you go see your primary care physician and you ask that physician to treat you. Well, guess what? You're going to state all the symptoms. You're going to state, all the things that have been happening. You're going to state the length of time that these things occur, and then you're going to, you know, pay close attention to the doctor, and then the doctor will direct you to a plan of treatment, whether it be medication, maybe change your diet. Okay, it's the same thing when you go seek a therapist or a psychiatrist. What you're going to do is you're going to share uh, all the symptoms that you are dealing with, and be honest. And really, there's nothing that you can say that can really shock a properly trained therapist, because I'm sure they heard virtually everything. And then the therapist or the psychiatrist will do an assessment. And then the healthcare professional will prepare a plan of action to deal with it. For some people, it may require medication. For other people, it could be trying to develop coping skills. Okay. For other people, it may be try to develop some healthier habits. The main thing, try to avoid is, by Pete's sake, do not use illegal drugs, okay, and alcohol. And I see that my niece, Michelle, has joined in Instagram. Good evening. Thank you very much for stopping by. Okay. You have to excuse me. It's just that I have to make sure that I acknowledge those who are watching on Instagram. Okay. So, and again, no. And the fact of the matter is, as much as 5% of the world's population has dealt with bouts of depression. So what it shows, that first of all, it's not an isolated situation. It can happen to anyone. Okay, and and the one thing that we should try to bear in mind, it is treatable. Okay. Okay. When it comes to like mild bouts of depression, usually it could be dealt with by developing some healthy habits, such as going on short walks, or making some sort of physical activity on a regular basis, making sure that you eat a healthy healthy diet. Okay. Also making sure that you're getting your sleep. Okay. Because if you're well rested and you are dealing with a healthy diet, you are better prepared to deal with the symptoms of depression. Okay. Left untreated, um, it can lead to thoughts of self-deletion. Okay. And now, first of all, I want to encourage anybody, whether they're watching this live or whether they're watching this on the playback. If there's anybody out there that's currently experiencing bouts of depression. Now, I see here we have a guest. So let me just state for the record that the views of those who appear depend on not necessarily those of the host or the channel. Any attempt to copy the material without the consent of the host is prohibited. By appearing on the call, you raise your right to your images. Some of the views that people hold may be considered offensive to some viewers. If you do not like the content, you can block the channel. And now we're going to bring our guest. Good evening.
Hey, Jose. Yeah,
How you
thanks
doing
for that.
tonight?
I'm doing fine because I'm telling people if you don't like my channel or what I say, you can start your own YouTube channel. But I suffer from depression. Women suffer from depression um, a lot more, and then we go through so many changes with our bodies. And I was on Zoloft. I took Zoloft to treat my depression,
Mm-hmm.
and I took my medication because a lot of times it'd be a chemical imbalance. When I was going through my mother's death, I suffered depression. When I found out I had cancer, I suffered from it. Um, and then when I was going through menopause, um,
Mm-hmm.
I suffered from it. And I took Zoloft and then I went to therapy. But
Mm-hmm.
uh, then I had some other situations in life that really had me down. A lot of times we don't even realize that we are depressed because we try to hide things and try to act like everything is okay, but it's really not. And so I'll tell people in a minute when you feel like you're changing or your body's changing or you're too overwhelmed with something, go see the doctor. We can pray about things, but sometimes you need more than prayer. You need medication and to get you back on track. And yeah, I took Zoloft and it really helped me in going to therapy. And
Mm-hmm.
like I said, women, we go through so much with our bodies that
I mean, when you think about it, I mean, first of all, um, during pregnancy, and this is something that some men they don't understand. Women go through a lot when they go
oh
through
God,
pregnancy.
yeah,
Okay,
yeah,
because first of all, you have mood swings. Okay, you have
yeah,
cravings. Okay, and then sometimes we have to be like an eggshells because truthfully we don't know what to expect. It's just that your body is going through so much stuff, and then you
yes,
have some a baby inside your womb, so you're going through all that,
right,
uh, and plus there's weight gain and things of that nature. So we have no idea what women go through when they're pregnant.
no, 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 and it's a lot, and you know that new thing that they came out with when women have babies. after they have the babies. I do believe that is real. Uh, I forgot, what do they call it? Um, After the woman has the baby and she
Is
can't
it post? It's post something or other.
post yeah, post traumatic disorder. And so yeah, because your body is out of whack. Um and it's just so much that a woman goes through. God, y'all, you men, just you'll never know. You'll never know.
Yeah,
Uh, you'll never know. You know.
yeah,
And
that's
so,
true. I mean, that's true because I remember uh, my mother, God rest her soul. Uh, she gave birth to my younger brother in the beginning of the year, and then she got pregnant again, and then she gave birth to my younger sister at the end of the same year. So you're talking about
oh
giving birth to two children in the same year.
wow, yeah, my brother and we're 11 months apart, and even though we weren't born in the same year, I was born in August, and he was born the following July, and so it'd be a lot. That's a lot, and men could never understand that. They could never understand that, but it's a lot. Women, we have so much because we feel like we want to do everything right so our baby is healthy. We want to love it. We're scared. You know, we want to. You know, we just go through so much, and you know, men they'll never know. They'll never know. And so, and some men, after they've seen a woman give birth, you know, they really have a good respect for women, and because they see what they go through. But yeah, it's a lot. It's a lot. It's just a lot for women, period, that we go through. And like I said, uh, you know, depression comes in all forms. You can get depressed going to a job that you don't like, um, people messing with you on the job, or you not getting promoted, you don't feel appreciated. Just regular life will cause some people to go into depression. And so
Mhm.
it's so easy to become depressed. And it's not to say that you are a weak person. Because a lot of times, we have to, people have to play like they're Superman or Superwoman. And you just get overwhelmed. I mean, it's a lot. It's a lot people have to deal with. Life, going to work, going to job, making sure the family is taken care of. Uh, just trying to do everything right. People are dependent on you. Um, so life puts a toll on people at times, and it's okay. And I always try to tell people, don't ever feel ashamed when you're going through anything. We have allowed society, what they have come up with as how we should act and behave, and it's not always like that. And so um
Well, well,
that,
it's true
that
that well, it's true that more women go through bouts of depression, but there are men that go through
oh no,
depression.
that's what I said, men too,
Yeah,
because they have a family that's dependent on them. They got to bring home the paycheck. They a true man wants his house to be in order. And so they go through depression if they lose a job, if they get laid off, just putting up with the stuff at work, and then they got to come home and be Superman. And so life will just take a toll on people. And I just emphasize with people. That's why I'm not ashamed to tell people what I went through, because we can't allow what society has deemed us how we should be. People look at people that suffer from depression as they're crazy. They might be mentally ill. They can't handle anything, or they're weak. And those things are so untrue. They're so untrue. Uh, life is a trip. And like they say, only the strong survive, but the strong get weak too. And it's nothing wrong with going through life and experiencing depression, where people don't want to go to doctors and just get the medicine, um, and then a lot of times too, you can have a chemical imbalance in your body. Yeah, man
Mhm.
and woman.
Yeah.
And so, you know
Yeah.
it's
But
okay if you become depressed, because if people truly love you, they're going to stick with you and they're going to be there for you,
yeah.
you know.
Well, the reality is when it comes to our generation, because we are both baby boomers, okay? Um,
Yeah.
we were not taught at first that it's okay to admit it, that
Oh
that
God,
you have we
no.
have.
That's why I always tell people it's okay. We oh my God, we dare not tell anybody, we were set, we were unhappy. We was feeling down. They were like, chalk it up, boy or girl, and get back out there. And nobody wanted to listen. You know, it's life. Keep going. You know, nobody they didn't give the person a chance to express themselves. It was, oh well, we went through harder times than this. You know, and so no, our generation. Oh my God, you know how society was with us. You just had to take a licking and keep on ticking, is what they used to say to us. You know.
Yeah, and the fact of the matter is, if you are a male, you're supposed to be tough, you're supposed to be stoic, you're not supposed to cry, you're not supposed to admit that you have a problem, because heaven forbid, if a male, particularly in our communities, acknowledge publicly that they need therapy, oh my goodness, they get,
Yeah.
the person is weak, the person is crazy, the person is mentally whatever. No,
Yeah.
the person is
Yes.
being honest.
Yeah. Yeah. So yeah, that's I always tell people, don't be ashamed of anything that you go through in life.
Yeah, and believe me,
Baby boomer.
yeah, and believe me, I've been through a lot. I mean, 2020 was a rough year because in the beginning of the year, uh, I lost my oldest sister to stage 4 lung cancer. While I'm still recovering from her passing, 6 months later, my mother passed away.
Yeah. Yeah, and death will take a toll on you. Losing the people that you love will take you to a place, man, I can't even tell people. You know, um, it'll knock you off your feet. It really will. It'll knock you off your feet. And um, and it's okay to grieve. You can grieve at your own pace. Don't let anybody tell you that. well, you should do this and do that, you know, um,
Yeah. Well,
especially if they haven't gone through it.
yeah.
Yeah.
One thing I like to tell people, there's no timestamp on grief. I mean, because everyone deals with grief differently.
Yeah. Yeah. Yeah.
Mhm.
And so, yeah. So I just wanted to come up and say that I appreciate you allowing me to come up, and thanks for talking about a subject that is, real and true, and you know, it is what it is. Yeah.
Well, I mean, this
Yeah.
is
And
something
so,
we both experienced this. So, and so if we can share what
yeah.
we went through, it would encourage
But
others who
like I
didn't.
said, in our generation, yeah, and like I said, the way we came up, people don't realize that we really couldn't express nothing. We had no say so in nothing, in nothing. We had no rights, no rights. You know, this is the way it was. This is what you're gonna do. Chalk it up. Keep going. You know, we didn't have voices back then. Like these kids do. We did not have a voice. Yeah, yeah,
And another thing, and this is something I've spoken about briefly when it comes to the African American community. I mean, they have to persevere a lot of sad stuff. First of all, they were brought to this country against their will. They were deprived of their culture. They were deprived of their identity. They were deprived of their languages. They were deprived of the life that they knew. They were forced to accept a lifestyle that they did not want. Um, their community was affected in all so many ways. The women were SA'd, okay,
yeah.
and all this
And
happened
men,
for about 250 years. Then you
yeah,
have to deal with segregation. So your
yeah,
community
yeah,
went through a lot of stuff.
right. And that's what I say with our community, you know, and that's what they used to say. We went through so much, you not going through nothing, nothing could ever compare to what some of our ancestors went through. So they didn't even want to hear it because they were like, shoot, we didn't survive slavery, integration, they just survived so much, and they kept on going. So they thought that we would be the same way, or thought we should be that same way, you know, and we didn't have a voice neither. Yeah,
Yeah.
no voice, no voice. Yeah,
Would you believe someone actually got upset with me because I made this statement? When it comes to issues with the African American community, the only ones that are actually able to deal with solve the problem is the members of that set community. Someone actually got upset with me for saying that.
uh, yeah. I don't worry about what people say, because at the same time, we all want the same things in life. And if you feel that way, that's how you feel. I mean, you know, um, I just respect everybody. I can't get into this, like, somebody can't say anything about us because they wasn't raised like us, or they don't know. But we don't know what other people went through in their households, in their homes. And so, yeah, I don't get down like that. Well, you know that I don't get down like that.
No,
And so,
I get it. I get it.
yeah. And
But
so,
this is a topic I've discussed before, and I will continue to discuss it because First of all, it needs to be discussed. Not many people are actually talking about it.
Nobody wants to talk about depression. They don't want to talk about suicide. You know, you just what went on in the household, it stayed in the house.
Hmm.
You wasn't supposed to talk about it. That was against the rules. You know, we couldn't talk about stuff. Like I said, we didn't have a voice. No, we didn't have a voice. What mom and daddy said went. You ate what they cooked. You know, we didn't have rights. You know, no type of rights. And so, it's getting better now. And I hate when people try to say some of the parents are trying to be their kids' friends. No, it's not that. It's just grew up in the era where we had no rights. We had no say so about
Hmm. Yeah,
all. And that's how it went. Yeah.
exactly. Yep.
Yeah.
Yeah.
Yeah. So yeah, I'm gonna drop down. I wanted to come up and just say that.
Okay. Well, thank you very much for stopping by. You know, you're always welcome here.
Thank for allowing me a voice.
You're quite welcome. But the fact, like as I stated before, now we're in an age where people are more encouraged to seek treatment, are more encouraged to seek therapy. So I'm glad that that's happening. There are people that it's still the stigma is still there when it comes to seeking help. So those are us who have dealt with bouts of depression. Our role is to let people know that it's not something to be ashamed of. It's something to acknowledge as a problem. It is treatable, okay, whether it be through therapy, whether it be through coping skills, or whether it be on medication. Yes, I believe in the power of prayer. Yes, I believe prayer can change your situation. However, there is a time and a place for therapy. There's a time and a place for medication. Okay, and that's something that it should be encouraged. So hopefully, if nothing else that you remember, just bear in mind that there's no shame to acknowledge that you're experiencing mental health issues. That there is no shame to go out there and seeking treatment, whatever. Because the worst thing that you can do is denying that you have a problem, and then your condition deteriorates, and next thing you know it, you're thinking of thoughts of deleting yourself. Okay, and what you do is when you actually do decide to take that step, uh, you leave your loved ones with a lot of guilt. And I just want to say that no matter what is going on in your life, you are important, you are valuable, you are loved. If nobody else but by God. Okay, so I would encourage all of you, if whatever is your mental health trauma, Don't be afraid to acknowledge that you need help and that you need. Okay. And you will thank yourself for getting the treatment that you need. You will thank yourself, and and then you can use your own uh, personal story to encourage others who are going through the same situation. And that's another good thing. Okay, first of all, each one teach one. So that's always a good thing. So I'm going to start to wrap this up. I don't think anyone is going to join the panel. Um, and again, this is something that I will continue to discuss because not too many people discuss it. Okay, so I will continue to use my platform um, to share whatever knowledge that's there. Okay, and hopefully you will you will take these words to heart. Now, I will be going live tomorrow night at 9:30 p.m. Eastern Standard Time, when I'm going to be talking about the myths regarding the Freedom Foundation. Okay. Now, it is an organization that try to illustrate itself as being pro-worker, and they're not. Their mission is to try to encourage people to forsake unions, okay, thinking that they can do better on their own. So I'm going to be sharing them this regarding um, what they do, and of course, and another string. I will talk about the benefits of belonging to a union. And one thing I always believe, it's much better to be a part of a union, even an imperfect union. Okay, are unions perfect? No, but even an imperfect union is better than no union, because there was once a time when unions did not exist and employees were at the mercy of their employer. So a huge shout out to Irby and April Showers for being in the chat. Huge shout out to April Showers for being on the platform. Check out her content and subscribe to her channel. And a huge shout out to all those who watch from the clouds, even the haters. So, of course, I'm going to close the same way that I always close. We must do everything possible to avoid the presence of the mentally and intellectually challenged, because if we fail to do so, we will be infected by the stupidity and massive insanity. This has been another episode of Uncommon Sense with Hossein Negron, saying good night, take care, and remember, you are very important in God's eyes. So please bear that in mind. Take care